Today we're joined by Dr. Riley Livingston. Riley is a mixed methods research methodologist, and the title of Riley's presentation today is Mixed Methods Research in Healthcare, an Introduction. And Riley's presentation will offer an introduction to mixed methods research and highlight why it is an increasingly popular and powerful approach in healthcare research. Also, Riley will explore what mixed methods research involves, key considerations for determining whether it's appropriate for a study, and provide an overview of the core mixed methods designs. So thank you everyone for joining us today, and thank you, Riley, for sharing your expertise. So I'll pass the floor to you.
All right. Hi, everyone. I'm just going to share my screen. See. Can everybody see my slides? Can somebody let me know?
Yep, we can see it.
Thank you. Great. So good afternoon, everyone. Thank you for joining me for today's session. My name, as Shrujane mentioned, is Dr. Riley Livingstone, PhD, and I work here in the Research Services Department of Horizon Health Network as the Mixed Methods Research Methodologist. And it's with great pleasure today that I kick off the relaunch of the Explore Horizon Research Talks with today's session on mixed methods research in healthcare. I'm going to talk a little about what mixed methods research is, why it's useful in the healthcare context, what some of the core designs look like, and how to decide if it's right for your study. Please note, though, that this session is designed to be practical and introductory, so we won't be delving too deeply into the theoretical or philosophical aspects of mixed methods. That said, if that's something you're interested in exploring or dissecting, please reach out to me or the General Research Services inbox, and we'd be more than happy to arrange a more in-depth session. All right, with that said, let's get started. So when people say a study is mixed methods, what do they mean? To put it simply, mixed methods research refers to combining both qualitative and quantitative approaches within a single study or research program. The goal is to integrate these two approaches, leveraging the strengths of each to gain a deeper, more comprehensive understanding of the research problem. To refresh you on the distinction between the two, quantitative research focuses on measuring variables in numerical terms. It uses methods like surveys, experiments, and statistical analyses to identify patterns, test hypotheses, and evaluate outcomes, things of that nature. Qualitative research, on the other hand, focuses on understanding human experiences and capturing context and nuance that may be overlooked in numerical data. Researchers use methods like interviews, focus groups, and observations to address questions about the why or how of specific phenomena. Now, in healthcare research, it's quantitative methods that are commonly used to assess interventions, like whether a treatment improves health outcomes. However, these numbers may not tell the whole story. For instance, in a study evaluating a new diabetes self-management program, quantitative data might show that key health markers and medication adherence improved overall over the study period. However, qualitative interviews could reveal that certain demographic groups struggle with the program due to financial constraints, digital literacy issues, or just lack of support. These insights help refine the intervention to better serve all patients. So in this way, by combining these approaches, mixed methods research can provide a more complete view of complex problems by exploring different dimensions of the research subject. And together they can offer insights that would not be possible using either approach alone. Now, why is it valuable in a healthcare context? Well, Mixed methods designs are useful to combine several perspectives, right? Providing more comprehensive evidence to answer complex research questions, especially in fields like public health and health service research, which we know have no shortage of complexity. By combining the breadth of qualitative data with the depth of qualitative insights, these designs leverage the complementary strengths of both approaches and minimize their weaknesses to provide a more holistic understanding. Another key aspect of mixed methods research is its potential to support patient-centered care. By incorporating qualitative components into healthcare research, we help ensure that patient voices and experiences are represented in the evidence base, something we might want to prioritize more often if we are truly to call our approach patient-centered. Mixed methods research also has significant potential to inform healthcare policy and practice. Decision makers often seek quantitative evidence, such as cost effectiveness or health outcomes, alongside qualitative context, such as personal narratives or barriers to implementation. Numbers alone rarely drive decisions, right? The context and narrative behind the data often provide that compelling story that's needed to inspire action. And so by delivering this dual perspective, mixed methods research aligns with how humans naturally process information, which can increase the likelihood of buy-in and support from key stakeholders. Now, while mixed methods offers undeniable value to healthcare research, deciding whether it's the right fit for any particular study requires thoughtful consideration. Firstly, and most importantly, the research question drives the method of inquiry. So think about your research questions or objectives. What are you trying to better understand? If your aim is to generalize patterns across larger populations, quantitative methods might give you a strong enough answer, right? It might suffice. But it's worth asking, could adding a qualitative component help answer this question or achieve this objective in a more complete, nuanced way? You know, mixed methods can be particularly useful if you're exploring some complex phenomena where context, lived experience, or deeper insights will be crucial to fully understand the findings. But then it's also important to consider what you're hoping to achieve, right? Think about what is your goal in understanding and in undertaking this particular piece of research, and who are you trying to influence, what their expectations might be. For example, if your objective is to influence policy, like I was saying on the last slide, or implement a new intervention, or make your findings more actionable or compelling for decision makers, mixed methods research can be highly effective. On the other hand, if your primary goal is to publish in a specific journal, you may want to consider the journal's openness to mixed methods research by reviewing its history with such studies. Of course, there's also feasibility to think about. A mixed methods approach, because it involves collecting and analyzing two types of data, requires careful planning and additional consideration. You want to ask yourself to use the time and funding to design and execute a study that integrates both approaches effectively. Does your team have the skills to handle both quantitative and qualitative approaches? If not, can you secure additional training or collaborators? Will you be able to recruit enough participants to meet the needs of both the quantitative and qualitative components? On the quantitative side, can you recruit enough participants to ensure statistical power? On the qualitative side, how will you recruit and consent participants? Ultimately, deciding whether mixed methods is the right fit means weighing what you want to learn, what you aim to achieve, and what's realistic for your team. Now that we've spoken a little bit about what mixed methods research is, its value in healthcare, and some key considerations when deciding whether it's the right fit for your study, I want to give a glimpse into some of the core designs. Seeing how the approaches are structured and applied can help give a clearer picture of what this actually looks like in practice. For this, I'm using Creswell and Plano-Clark's typology of mixed method study designs. And so on this slide are two types of concurrent designs. This is where data is roughly collected at the same time. A popular choice is the triangulation design, also known as a convergent design. This is often the first that comes to mind when a researcher hears mixed methods. It involves collecting and analyzing the quantitative and the qualitative data separately, but at the same time, concurrently, with the aim of comparing or combining the results for a more comprehensive understanding of the research question. In triangulation designs, the types of data are given equal importance, meaning neither takes precedence over the other. Next, we have the embedded design. In an embedded design, one type of data supports or enhances the other. Most often, but the reverse is also true, but most often, a qualitative component is embedded or nested within a larger quantitative study. The qualitative insights can help provide additional context or explain findings from the quantitative analysis. The secondary data set is nested within the larger study context and typically involves a subset of the participants of the larger study. There are also sequential designs. Like their name implies, sequential designs unfold in distinct phases where one type of data collection builds on the other. In an explanatory sequential design, you begin with quantitative data collection and analysis. The findings from this phase then guide a second phase of qualitative data collection to help interpret or clarify the results. In an exploratory sequential design, the order is reversed. You start with qualitative data to explore a topic or identify patterns, and then you use those insights to design and conduct a quantitative phase, often to develop a quantitative instrument. A key strength of sequential designs is their purposeful integration of phases. Each phase builds directly on the analyzed results of the previous one, creating a cohesive and connected approach to the research. I won't lie to you, however, mixed methods can be challenging. It takes careful planning, resources, and the right expertise to pull it off well. To start, mixed methods research tends to be more resource intensive because, in a way, you're running two studies, sometimes at the same time, sometimes in phases. Either way, it takes planning to make sure you have enough time and funding to perform both the qualitative and quantitative phases of the research. Many don't realize that qualitative data in particular is quite time-consuming and labor-intensive. So you want to keep that in mind, which brings me to a related challenge, the need for additional expertise. Mixed method studies require a balance of quantitative and qualitative skills. So if your team lacks experience in one of these areas, you might need training or to bring in additional expertise. It's no secret that in healthcare research, many teams are often more comfortable with quantitative methods, so qualitative expertise is often essential to bridge that gap. There's also the matter of data integration. Integration is at the heart of mixed methods. It's where the two approaches come together to create something more meaningful. Integration is quite complex and can take several forms and happen at multiple points of the mixed methods project. Common approaches, though, at the interpretation and reporting level of mixed methods include integrating through narrative and integrating through joint displays, essentially showing quantitative data alongside qualitative data in a table to illustrate some area of convergence, divergence, or complementarity. However, achieving meaningful integration can be tricky and requires thoughtful execution. This is one of the reasons mixed method studies undergoing HRPP review are encouraged to at least reference integration and provide some indication of how they plan to achieve it. It's also important to mention mixed method studies often face publication challenges. They often result in longer manuscripts, first and foremost, which can be tricky to fit within a standard journal's limit, right? Because you have to write the methods, findings, and integration of both. And certainly some journals and fields still show a clear preference for single method studies. That said, in healthcare research, mixed methods approaches are generally gaining greater acceptance. And while these challenges can feel daunting, they are not insurmountable. If you're a researcher at Horizon and you're thinking mixed methods could be valuable, but you aren't sure how to approach it in the context of your study, you're not alone. Let's talk about the support and guidance that research services can bring to your mixed method study. It all starts with a consultation. So provided you are Horizon affiliated, reach out and we'll set something up. During these consultations, we'll work with you to talk through where you're at, get a sense of what your research questions are, your ideas around study design, and what sorts of resources and expertise you're working with. And from there, we'll tailor our support to meet your needs, keeping in mind our capacity at the given time. Some of the ways that we can help include deciding whether mixed methods is the right fit for your research question and constraints like timeline, sample size, and budget. We can provide advice to help you craft a clear, well-structured research protocol that aligns with mixed methods principles. We also have a protocol guidance document to help with that I can send folks that are interested. If you need funding, we can help you find grant opportunities and help you to write strong applications and proposals. We also offer training in qualitative research, such as delivering interviews, conducting focus groups, and analyzing qualitative data. We can also support you with integrating and reporting your mixed methods results. Finally, I also need to mention SOAR. Under our Support Opportunities and Assistance for Research program, Horizon-affiliated clinicians or staff, those without clinical research support, I should say, can apply to the program, and successful applicants to the SOAR program are granted comprehensive access to a team of highly skilled research professionals with experience in quantitative and qualitative methods, as well as clinical research conduct and administration. Please note that the next call of applications for SOAR is April 15th, and they are happy to work with folks to help them develop their applications. So to wrap up, let's take a moment to review what we've covered and how mixed methods might be fitting into your research plans. First, we defined what mixed methods research is. It's an approach that combines and integrates quantitative and qualitative data to give a fuller view of a research question. We discussed why mixed methods is valuable in healthcare and went through some of the core designs. We also looked at some important considerations for deciding if mixed methods is right for your study, but ultimately deciding whether to use it comes down to balancing your study's goals, the value that mixed methods could potentially bring, and balancing that against what's realistic for your team and its resources. And finally, remember that while mixed methods can be challenging, our team at Research Services is here to support you. Just send a message to researchservices@horizonnb.ca, and we can work with you to move your research forward.